Okay, so in this emergency first aid at work course, we're going to look at 3 different types of burn. So we've got our superficial burn, our partial thickness and our full thickness burn. So if it's a superficial burn, you're going to see redness and just the top layer of the skin that's been affected. So it's going to be quite painful and quite sore to touch. What we're going to do for that superficial burn is run it under cool water, so cool running water for a minimum of 10 minutes. We may have to send this casualty to hospital, dependent on a couple of things. So if it is due to a chemical burn, then they would need to go to hospital, but also if it covers more than 5% of their body. So how do we know if it's more than 5% of their body? 1% would be the casualty's palm of their hand. So if it covers more than 5 palms of their hand, then they would need to go to hospital. For a partial thickness burn, you might see some blistering and some breaking of the skin. If you see that, again, run it under cool water for a minimum of 10 minutes and then look at applying some non-adhesive dressing, so something that's sterile. If you've got some clean film or something like that, then that's brilliant. Just tear off the first couple of sheets and then just apply that over the wound and just give it a little scrunch at the bottom. Don't do it too tight, don't wrap it around the wound. For a partial thickness burn, if it's more than 1% of the casualty's body, so just 1 palm of their hand, then they would need to go to hospital. Or if you're worried about any infection or you're not sure, just get them to go to hospital to get it checked out, make sure they're okay. For a full thickness burn, obviously this is going to be very serious. It might look quite charcoaled, there might be some waxy deposits, and also it may have severed the nerves, so they may not have any feeling of any type of pain. We may need to treat for shock in this case, and you may need to carry out some basic life support, so CPR if they was to stop breathing or go into shock. So for a full thickness burn, again, run it under cool water for a minimum of 10 minutes and even apply some dressing and call for an ambulance as quickly as possible. Okay, so in this example we've got a superficial burn, so as you can see there is redness, it's very sore for him and it's very painful to touch. So what we're going to do as quickly as possible is get him to some cool running water. It's important that it's just cool and not too cold, we don't want to cause hypothermia. If we can't get him to a tap, we can bring the water to him. Okay. I'm just going to pour the water on your hand now. What we need to do is do this for a minimum of 10 minutes. So if you've had to bring water to them, you'll need someone to keep supplying you with some more water. Make sure your casualty is feeling okay, and if they need to sit down, get them to sit down whilst you do this. Okay. After 10 minutes, we are going to have a look at the wound. If there is any blistering appearing or anything like that, then we may need to get them to go to hospital. If we are worried of any infection, we can cover it with a sterile dressing. Something like clean film is brilliant. Just tear off the first roll and then use the sheet after that so that it is sterile. And just place some clean film over the top and just scrunch it at the bottom. Don't do it airtight. But we can still then see the wound and we can still run the water over and see what's happening with that. If it is just a little superficial burn like this, then they shouldn't need to go to hospital, but as I say, if we are any worries about infection, then we would do.